This week, as expected, the Senate Judiciary Committee voted to recommend the confirmation of Sonia Sotomayor as Supreme Court Justice. Watch the committee debate and see the vote this Saturday on C-SPAN at 7 Eastern. Then next week, her confirmation moves to the Senate floor. Live coverage of the full Senate debate on C-SPAN 2. And coming in October on C-SPAN, tour the home to America's highest court, the Supreme Court.
On C-SPAN Radio, hear 1968 LBJ phone calls with his Secretary of State, Dean Rusk, Republican presidential nominee Richard Nixon, and evangelist Billy Graham. Saturday at 10 a.m. Eastern on C-SPAN Radio.
George Wythe signed the Declaration of Independence. He was also murdered. Q&A Sunday, author Bruce Chadwick on I Am Murdered, George Wythe, Thomas Jefferson, and the Killing That Shocked a New Nation. At 8 p.m. Eastern and Pacific on C-SPAN.
Washington Journal continues.
Congressman Earl Pomeroy is a member of the Blue Dog Coalition, and we're continuing our discussion about health care. We've been showing people the three major provisions of the deal or compromise that the Blue Dogs on the Energy and Commerce Committee struck with Mr. Waxman and others yesterday. There's a line in a statement from the Blue Dog Coalition that says the 52-member Blue Dog Coalition has not taken a group position on the draft health care legislation. Today's announcement signifies the committee process is moving forward. The committee will work its will, but the broader coalition has not ratified any agreements related to the draft legislation. What should we take away from this?
Well, look, each of us have our responsibilities to the districts that sent us here, and we're going to continue to exercise those, and that means we're probably not going to think of entirely one mind on these matters. The Blue Dog Coalition in the House plays a very important role. We want to make certain that the government runs in a fiscally prudent and appropriate way, that we live within our means, that we address the nation's problems. So we share the same philosophy as Blue Dogs, but even the committee vote with 4 Blue Dogs deciding this is a deal worth taking, 3 not quite there yet, shows that it was, 3 yards in a cloud of dust kind of forward, but not a breakthrough that's going to suddenly send this thing through the House.
Daniel Henniger is a longtime member of the Wall Street Journal editorial board and has a column in the paper today, The Blue Dogs' Final Dilemma. And here's what I'd like to have you read. It's a philosophical statement about the role of government. The struggle over health care legislation isn't just another battle between Democratic and Republican parties. It's about which force is going to take the United States forward for the next generation, the public sector or the private sector. If by now you haven't figured out which sector you are in, then you're a Blue Dog Democrat. Here's how he concludes. For centrists in both parties, the moment has come to decide which side of the public-private divide they want the U.S. and its future workers to be on. Trying to live in both has brought us inevitably to that decision. What do you think about what he's written?
Well, I disagree with the premise. These people think it's got to be all government or no government, that just aren't dealing, in my opinion, with the difficult realities of the 21st century. Let's take health care. Medicare. It's a government program. Medicaid, providing health care for those who can't afford it. Government program. Making certain our veterans have the health care they have earned. Government program. But on the other hand, most of us have private coverage, privately insured, provided by private doctors, private hospitals. It's a mix now. It'll be a mix at the end. Our challenge is to make sure we keep what works and people like, but address the things that don't work. And most particularly, right now American families have no security that they will always have coverage. They lose a job, they lose their coverage. Maybe someone in the family has a medical condition. They can't get additional coverage. We want to make sure at the end of this whole reform effort, as Blue Dogs and as Democrats, that families will have the assurance they'll always be able to obtain health insurance that their family needs and be able to help, and they'll be able to afford that coverage too.
Mr. Pomeroy was first elected to the House in 1992. He is at large for North Dakota, and he serves on Ways and Means Health Subcommittee. and also Social Security and Trade and Agriculture Committee. Before coming to Congress, he was a lawyer in private practice, served in the North Dakota House of Representatives from 1981 to 85. He was the State Insurance Commissioner for North Dakota and served as president of the National Association of Insurance Commissioners. How does that work shape your thoughts on what was the appropriate health care package for the United States?
It's incredibly helpful. The business of being an insurance commissioner is making sure that consumers get fair shake by insurance companies. You know, a big portion of this health reform effort is insurance reform, so that right now, you know, the more you need coverage, the less inclined insurance companies are to want to provide that coverage. We're going to change that. People will be able to get the coverage they need. So when it comes to dealing with insurance companies and trying to get consumers a fair shake, I did that before I ever got here as a state insurance commissioner. I'm the only former state insurance commissioner in Congress. I think it's given me a very useful perspective that I'm trying to put, you know, into the mix here as we try to build a plan that'll work.
Why are the insurers supporting the reform legislation?
Well, I think that at this point they're waiting to see what the final product is. But we all know we're on a course that can't continue forever. Since the time I was insurance commissioner, healthcare costs in this country have gone up 300%.
And why are they going up?
Well, they're going up because we have medical inflation that year in, year out runs about 2.5% over regular inflation. And so costs keep getting more and more expensive. As a result, the premiums to cover the claims paying for those costs keep going up. We've had now 45 million people without coverage at all, and tens of millions more that have coverage, but they don't have any certainty that by the time they're done with the deductibles and the co-pays and the whatnots, they're going to be medically bankrupt if they have a serious health event in their family.
Let me keep picking at this so we all understand. Why are costs in medical care going up higher than the rate of inflation? What's the source of that?
Well, I think that that is the heart of the problem. We've got to get our hands around why costs of care continue to go up. Now, we've had some wonderful technology breakthroughs and improvements in medicine. We salute those. But on the other hand, there's some very disturbing evidence that we've got procedures being administered that are not necessary, that are not contributing to public health. As you look at the cost of care across the country, tremendous variation, even within the United States, variations of 2 or 3 to 1, depending upon the number of claims, the number of procedures provided, and bills sent to insurance companies. I think that we need to get our hands around these high utilization areas where costs continue to just absolutely outstrip all other parts of the country. The most astonishing thing about this is that there's pretty good evidence that there's no link between the highest cost of care and the highest quality of care. In fact, there's Medicare data from all the claims Medicare pays that shows very often the highest quality is occurring in the lowest cost regions in the country. We need to get our hands around what's happening there.
If you've joined us along the way, you might not realize we've been at it for 2.5 hours plus here. It's Healthcare Thursday, and we've been listening all morning to your comments about healthcare legislation as it continues to work its way through Congress. Mr. Pomeroy joins us in that conversation. Sir, let's get to some phone calls for you.
Great.
This one is from Eagle River, Wisconsin. Ron, Democrats line.
Yes, good morning.
Good morning.
Hi, Ron.
I've got 2 questions. First, I'd like to ask the representative if he being a small state, why he should stand in front of the rest of the country and hold up health care. That's one of the questions. Second question, sir, who do you represent, the people or the health care industry? And how much money do you receive from the health care industry in donations?
Sure. I'd be happy to respond to that. First, there's kind of a premise to your first part of the question that I want to address very directly. You say, well, coming from a small state, who are we to block national health reform? Look, national health reform has to work for rural as well as urban areas. We're in this together as 50 states. I've got people that are just as concerned about their health care as New York City, LA, or anywhere else. And what we've had in the House is a plan that I believe would bankrupt every hospital that I represent. If you have a public plan option, paying at Medicare rates, we will bankrupt the North Dakota health care delivery system. Now, I don't think that's much for reform. I wouldn't want to be part of reform that devastates the health infrastructure of any state. And it's my job to make sure we get fair play in rural parts of the country just like anywhere else. So that's the first part of the question. Secondly, I find in this debate, you know, you raise some objections. If you're not just going to go with the flow here, people will start pointing at what kind of motives you have. Look, it's not surprising that being the only former insurance commissioner in the House, I know something about this industry. And so people are going to say, oh, gosh, look, he's on the take. That is just a simple way of trying not to deal with the substance and the merit of the issues that I'm raising. I've got a background here that matters, and I'm interjecting it into this debate.
I want to read to you a paragraph from, again, Wall Street Journal. This is from their lead editorial today. They write, under the House bill, firms with an employee payroll of above $250,000 without a company health plan would pay a tax starting at 2% of wages per employee. That rate would quickly rise to 8% on firms with a total payroll of $400,000 or more. A tax credit would help very small businesses adjust to the new cost, but even a firm with a handful of workers is likely to be subject to this payroll levy. As we went to press, Blue Dogs were taking credit for pushing those payroll amounts up to $500,000 and $750,000, but those are still small employers. From your Ways and Means perspective, would you comment on that, please?
Susan, let me quickly provide a conceptual framework for how this bill works. If we're going to make certain that families have the ability to get the coverage, no matter what, when they need it, we're going to have everybody in. We can't just have the old and the sick in an insurance pool and have affordable premiums. You want to have the young people, people at all stages of their lives in. Now that means you've got to have universal coverage. If you're going to have all in, we need to have making certain everyone is participating. If you're going to have that, you're going to have employers play their role, and those people that, for one reason or another, are not getting their coverage at work, an expectation that they pay their role. That's going to have to involve some premium subsidies because not everyone can afford the kind of coverage, the cost of coverage. Circling back then, people in the employers, including small employers, are going to have to do their part. Now, some of the discussions here conducted on behalf of Blue Dog Concerns I think were extremely important, and they got the small employer exemption doubled. And so, like the article notes, $250, that's no longer applicable. The lowest charge on small employers will begin at $500,000 payroll, and it'll ratchet up so it's fully implemented at $750,000 payroll. That we recognize will bring small employers in, but we believe that the smallest, most vulnerable, most financially strapped employers will now be excluded under those Blue Dog limits.
Next question for Mr. Pomeroy is from Abilene, Texas. This is Shirley, Republican.
Yes, Mr. Pomeroy.
Hi, Shirley.
Everything we're doing now is being done on borrowed money. Everything. And we are going to be a debtor nation for the foreseeable future. I think we need to pull up on the reins and try to get this under control before we go into something as massive and all-encompassing as federalized health care, because right now the government doesn't have a very good hold on what's happening, and they're treating the American taxpayers like nothing. We have millions unemployed right now and seeking jobs. We have millions of illegals here seeking jobs, and you're talking about spending billions and billions and billions. Try to get the economy under control and go at this medical business with a little more measured consideration. This is ridiculous at a time like this.
Shirley, thank you. Appreciate the comments.
And Shirley put a lot on the table there for me to respond to. Let me respond first, but she said we should take a measured approach. Well, I do think we want to, while directly addressing the major problems facing this country, which include health care, make certain that we're preserving what's working, addressing what's not. The Blue Dogs felt very strongly that a vote before going back for the August recess period was too much, too quick. We wanted to have these weeks of August to go back to our districts all across the country, hold forums, interact with our constituents, listen from all the stakeholder points of view, so that we get the perspectives of the people we're representing before we come back and are asked to vote on a bill that would be brought before the House. So I agree with her on that. I agree with that we just can't continue to run up this horrible national debt. President Obama has put out as a central marker, and we support him completely, this bill must be paid for. Peter Orszag, the head of the Office of Management and Budget, has said it must be paid for not just over 10 years. The second 10 years also have to be paid for. So we're talking about something that does not run up the national debt. Let me contrast that to the prescription drug bill, for example, of President Bush. It wasn't paid for a speck, not a nickel, all on the debt. Well, that's the wrong way to do business. And so when President Obama says we're going to pay for this bill, that's an important matter. Finally, we really can't afford not to do something. Again, left to its own devices, healthcare costs have risen 300% since I was commissioner in 1990. Government pays about 55% of the healthcare bills in this country. Runaway health inflation, these utterly out-of-control cost increases are bankrupting families, but guess what? They're threatening the very financial stability of the United States of America, and that's why we have to do something.
React to this comment by Twitter from Tosin Ogunsili. The Blue Dogs are protecting rural area hospitals where the majority of folks don't have insurance and rarely pay for services. We pay.
I think that, again, the premise is not entirely correct. In North Dakota, we have rural hospitals, but our uninsured rate is about 10%, which compares fairly favorably across the country. The premise of that comment would again seem to be, well, who cares about rural? We need health reform. Who cares about rural? The reality is we've got to pass a plan that works for everyone. Believe me, the American people, whether they live in big cities or whether they live in the countryside, ought to have their health insurance system improved. They ought to have the security. They and their family are going to get coverage. And to have some suggest, well, look, you can fix it in my neighborhood and I don't really care about yours, is not going to go. And we're going to have to make certain that we all win under this thing, or no bill's worth passing.
New Carlisle, Ohio, Bernie, independent line for Mr. Pomeroy.
Good, beautiful morning to you, Mr. Pomeroy.
Hi, Bernie.
How are you this morning?
Good, thank you.
I could go on and on and on, but I'll try to be as brief as I can with a statement and a question. Well, I guess question first and then a statement. Have you ever heard the term KISS?
Yes.
And what does it stand for?
Well, or keep it simple, stupid.
Right. I like to say keep it simple, salesperson, or keep it simple. I sold life and health insurance when I first got out of college. And over the years, I've had friends of mine who became self-employed, and they would say, Bernie, what do you recommend? And I would always say, I can't tell you what I'd recommend because even an attorney cannot understand the average health insurance contract. And I'm really amazed at the number of emails I'm getting now from the right wing that are saying all these demagogic things about the health care proposals going on. There was a gentleman on television the other day talking about the fact that the minute we try to integrate a public plan with the private insurance industry, it becomes very complex. And that complexity is what allows people like Bernie Madoff and Wall Street to do what it did because they invented these very complex investment tools. And look at the number of people, the billions and trillions of dollars that were scammed from people. And I'm afraid that's what's going to happen if you try to integrate private and public. Why don't people just Google Canadian healthcare? Google Canadian healthcare and see what it says about how many 85 to 95%
Bernie, thanks. We get the point. I'm going to stop you. Thank you.
Bernie, there's a part of what you're saying that I really want to address, but maybe it's slightly off where you were going with your question, and that is extraordinary complexity in health insurance. And as someone with a background in insurance, you and I expect to agree on this point. The great failing of health insurance in our country is that health insurance companies have found that it's much more cost-effective to figure out how to withhold coverage from people who need it than to manage the exploding costs of health care for those who have coverage. So they're really in the coverage denial business rather than the cost management business, and that has been a problem. Now, we hope that whether a new competitive element on the scene. The Senate's talking about cooperatives. That's a fine notion. The Blue Dogs advanced the notions of cooperatives in the House negotiations. A public plan option, as long as it plays fair and square, is a good competitive. Maybe adding more competition in that insurance marketplace is going to help at last focus not on just denying coverage to people who need it, but making certain people have the coverage is going to keep them and their family secure while we make sure the coverage continues to be affordable. That's really the thrust of what we're trying to achieve.
In a system that, whether it's a combination of private, public, or universal private insurance, if it's a system is based on fee for service, how do you ever keep those costs you told us about from escalating?
I think, once again, Susan, you really put your finger right on the pulse of it. It's fee for service. We pay for every procedure provided. In other words, the greater the volume, the greater the payment. A witness to the Ways and Means Committee told us, we've got a system that responds to incentives. And if you provide incentives for volume, you're going to get volume. And that's exactly what has, I think, been the driving force of medical inflation over all these years. There's some very interesting and different approaches to healthcare. Some of the best medical systems in the country have doctors and hospitals under one enterprise. They're called integrated systems. The doctors are salaried and basically given the kind of time they require to make certain they understand their patients' needs and can prescribe accordingly. That's such a preferable thing, I think, for so many physicians to the kind of pressure that other systems have them on, where they run people in and out about on the quarter hour because they've got to hit their billing target. It's no way for these skilled professionals to be practicing their art and their science. We ought to, I think, look at ways that provide some relief from this fee-for-service billing pressure that we've put upon our doctors. And hopefully, the kinds of insurance reforms that we're advancing, the new competition in the marketplace, some of the other cost ideas that we've advanced in this bill are going to evolve our system away from this curse of fee-for-service over time.
Then you agree with this viewer, Will Robertson, who writes, to control costs, consumers must shop for services. How can you work that into the legislation?
Well, I hope that we do have more of an opportunity to know what the costs are and what the consequences are going here or other places. One of the bills that I've introduced that's incorporated in the House package would create what's called an accountable care organization. And in this, the doctors and the hospitals come together. They establish quality targets to make sure they're providing the finest quality care. And then they shoot to make sure that their operations are performed more efficiently than in the past. If they are, they're given what's called gain share. They're given a portion of the savings that they contribute to the system. And in the end, I think this is going to create a very interesting opportunity for providers and for consumers alike.
Next telephone call is from Stapleton, Georgia. This is Bill, Republican line.
Good morning, C-SPAN.
Hello, Bill.
Good morning. Okay, I have a question and then maybe a follow-up. I would like for you, as an elected servant to the American people working in the federal government, excuse me, to be able to provide to us a copy of your contract with your insurance so we can better understand how you're covered.
Thank you. We get that question a lot about the Congressional Health Plan and why Americans either can't have a program like members of Congress do. So can you respond to Bill?
I think we want to provide coverage like members of Congress have in answering Bill's question. My specific coverage, Bill, you could learn from the standard options available to any federal employee. I've got the Blue Cross option. And so if you want, I expect maybe that's even available online. You can look at the terms of the coverage I have for me, my wife, and my children. And so I think that is important that we play that one wide open, and you'll have that information. Again, it's the same as any other federal employee.
Here's a live picture from inside Henry Waxman's Energy and Commerce Committee. They're scheduled to get back at their markup of the legislation in about 5 minutes from now. As you can see, our cameras are there with the House in session today. We're going to be televising that live on C-SPAN 3. If you don't have C-SPAN 3, you can also watch it streaming live on the internet at cspan.org. For Mr. Pomeroy, next question. Townsend, Tennessee. Kerry, Democrats line.
Yes, sir. I have a comment. Now I have a short question. I've been on disability for 17 years. I've had Medicare, and in that 17 years' time, I haven't been able to afford any kind of dental coverage. And I don't know if you know, but your dental can cause you a lot of other illnesses and pains and stuff. I've had to allow my teeth to rot out to get rid of them because I couldn't afford $90 to get them pulled. Well, when I used to be on food stamps, and I mean this still has to do with health care, but on food stamps I could buy potato chips, I could buy candy, but I couldn't buy a toothbrush, I couldn't buy toothpaste. And I'm wondering if maybe you guys shouldn't look at allowing dental on Medicare, allowing people to buy hygienic items on food stamps. And my main question to you, sir, is would you stay in session through August to get this done?
First, let me express my sympathy for the situation that you found yourself in. The deal with your teeth is horrifying.
Did you know that you couldn't buy toothpaste and toothbrush with food stamps?
The food stamps are for nutrition. I do think the caller raises a very interesting point, Susan. You get yourself a liter of sugared pop, but you can't get a toothbrush. That just does not sound right. We are trying to address in the bill dental coverage. And have it covered under the standard plan. We understand the link between dental care and health. And in fact, the papers in Washington carried the horrific story of a boy who died because he couldn't get a tooth extracted. That occurred a couple of years ago, and he was about the age of my son. That one really impacted me personally in terms of its emotional impact. And we try to deal with this whole healthcare picture. Dental's part of it. Now, you mentioned August. Look, I think the best thing we can do in August is go back and talk to the folks we represent about this. You know, this is a big issue for our country, and I think we're having a very lively conversation about it. It's important to have this lively conversation. Susan, anchoring this chair for 3 hours today. This is precisely what has to happen as we assess where we are. Well, we all, I think, in looking at that, these runaway costs, 45 million uninsured, tens of millions or more without the fundamental security they'll have insurance when their family needs it. You come to the conclusion that the status quo is broken. We need to do something. And then what to do is the trick of it. And I think that the best thing we can do is not talk to ourselves, but go back and make sure we're talking to the people we represent. So we've got a better idea of what we're going to do when we come back. Now, the bill will be marked up in each of the 3 committees. The Energy and Commerce is going today. Education, Workforce had their markup already. Ways and Means had their markup already. I've heard this Energy and Commerce markup that, again, will be carried on C-SPAN 3. One of the committee members said this is going to be the mother of all markups. So I think you're in for a long but probably interesting go of it as they mark that bill up. So we'll have these various approaches out there through committee for people to consider as we have these discussions during August.
Round Rock, Texas. Kermit, you might be our last caller today. What's on your mind about health care?
Yes, good morning, and good morning to you, Representative.
Hello, Kermit.
To speak to you. I just wanted to share some health care stories with you about myself. I'm 68 years old, but first of all, I want to thank you for telling the gentleman earlier about the government insurance plan. All government employees have the same plan. It's a menu of plans that they can select. I worked for the government, and we chose a Kaiser plan out in California that was fully approved by the U.S. government. So the delivery system is out there, and there's plenty of delivery systems there. So in my mind, my question is this. I see the healthcare system operating very much like Medicare, and all the government would be doing would be processing and paying for billing. Once the standards have been set for healthcare, it can't be rationed, which is one of the scares out there, and I don't think any of us Americans would stand for rationing very long of anything. But again, there's lots of small clinics out there where people can just go get their checkups with a community doctor if they want to do that. So that would put the price down. But also, from being an insurance expert, is that the insurance industry is top-heavy with management and lawyers that do nothing more than to manage the care that's being issued to the